Today we shall see some commonly used terms in anatomy. First of all, what is a plane? A plane is a flat surface formed by a real or imaginary cut in the body. So there are three planes: coronal plane, sagittal plane, and transverse plane. Coronal plane divides the body into anterior and posterior parts. Sagittal plane divides the body into right and left parts, and the transverse plane divides the body into superior and inferior part. Here I am using my child's toy just to demonstrate what is a plane. So first we see what is a coronal plane. If I cut this toy like this from here straight down, so this is the anterior part, that is the front part. What is the meaning of anterior? The front part. And the back part will be the posterior part. Okay. So taking a cut like this divides this toy into the anterior part, that is the front part, and the posterior part, that is the back part. Second is sagittal plane. If I cut this toy right in the middle, the line will divide the toy into right and left parts, right part and left part. So sagittal plane, this line which goes right through the center is called median sagittal plane. Okay. Now the transverse plane. If I cut this toy right here, like we cut a cucumber, so if I give a cut like this, the toy shall be divided into superior part and inferior part. Superior and inferior. Okay. So coronal plane cutting like this divides the body into the anterior, that is the front part, posterior, that is the back part. Sagittal plane cutting it like this divides the this toy into right and left parts. This line through the center is called median sagittal plane, and the transverse plane cutting it like this is dividing the toy into superior and inferior parts. Anterior or ventral, anything in front. Posterior or dorsal, anything in back. Medial, near the median sagittal plane. Lateral, away from the median sagittal plane. So if we see this kangaroo with its baby, the baby is in front of the kangaroo. So the baby is anterior to the kangaroo. The mother is behind, so it is posterior to the kangaroo. As we saw, this is the median sagittal plane. So this eye is near this line, so it is medial. This hand is away from this line, so it is lateral. Superior means above, inferior means below. Proximal, near a structure's origin. Distal, far from a structure's origin. Cranial means near the head. Caudal means near the feet. Caudal is the Latin word for tail. Rostral, this word is used to describe a structure's position with reference to the nose. Example, forebrain is rostral to the hindbrain. What is superficial? It is near the, we can say near the skin or near the external surface of the body. So anything above the deep fascia, there is a fascia, a layer of tissue which is called fascia. Structures above that are called superficial. What are those? Skin, superficial fascia, and the mammary glands or the breast. These are the superficial structures in our body. These structures are, what are the deep structures? The structures below the deep fascia, that those are the skeletal muscles. The viscera. What do you understand by viscera? The abdominal organs. Those are called viscera. Abdominal means organs in the thorax and abdomen together. That is, for example, lungs, the heart, intestine, stomach, liver, pancreas, everything. These structures are enclosed by deep fascia. So structures above the superficial fascia, above the deep fascia are called superficial structures. Structures below the deep fascia are called deep structures. Again we revise: superior, inferior, for proximal they say that it is near a structure's origin. If we consider hand of this toy, okay, this is the origin of the hand. You can see this part, this is the origin of the hand. So this point is proximal, means near. What is the meaning of proximal? Near. What is the meaning of distal? Away. Proximal, distal. Cranial, caudal. Cranial means near the head, caudal means near the tail. Some words that describe movements: flexion, bending, extension, opposite to flexion. Abduction, away from the midline, adduction, near the midline. Circumduction, moving a limb in a circle. Medial rotation, moving anterior surface of the distal bone towards the midline. Lateral rotation, opposite, moving away from the midline. Protraction, moving forward. Retraction, moving backward. Dorsiflexion, moving foot up at ankle joint. Plantar flexion, moving foot down at ankle joint. You can refer the social media to understand all these movements. Alright, these are all notes based videos, notes derived from standard textbooks to help you understand the situation better. Thank you.